strategic impact is in health systems, innovation, and management. And as a group, we're all focused on addressing local and international healthcare challenges. We don't just focus on research, we're also very interested in conducting really high quality teaching and mentorship through the supervision of graduate students.
Yeah, one of the things that I really like about the health ASI in particular is we have a wide range of people doing a wide range of research. We have people like Agnes who are doing sort of qualitative research on policy, health policy, or mixed methods. And then on the other end, you have people like myself, Antoine Sauret, who are doing more quantitative analysis, operations management of healthcare.
Our research is about healthcare systems, healthcare innovation, and healthcare management. Healthcare is important to everyone. It affects every single person, whether directly or indirectly. Our work aims to improve the health of Canadians and the health of people internationally. So that's how it has impact. It's truly something that affects everyone. One example of how we're working with community organizations is my graduate student, Madeline King. She's doing her thesis on the idea of continuity of care in a long-term care center. The Pearlie and Rideau has recently implemented a new program called the CME program. So Madeline is going into that organization. She's going to be speaking with senior executives, care providers such as physicians and nurses, as well as actual clients to better understand what factors support continuous care. Another graduate student that we have, Raphael, who's conducting research under the supervision of Dr. Lisanne Lessard. She is an expert in health informatics, as well as Dr. Antoine Sauret, who's an expert in advanced health analytics. They're both supervising Raphael, who's conducting a project in partnership with the Department of Psychiatry and the Department of Pediatrics at the Children's Hospital of Eastern Ontario. And how do we use data to select better treatments that are really aligned with the goals of the children and their families.
Kevin Brand is another professor here. He works in health risk management and health economics a little bit. And one of the things he's really interested in is population health and how we measure the impacts of population health. So one of the things he's doing is figuring out how this measure is related to this other measure, even though they seem to be completely different. So he's helping to improve how we understand the impacts of policy on health population.
Jonathan mentioned earlier that we're all very different as researchers within the ASI, and while that could be seen as a disadvantage, it's also an advantage because we're able to do interdisciplinary research that then gets better results. So that's part of the mission of our ASI, is to partner in order to create impact.